Sorry, my name is William Osborne, 162 Oak Ridge Drive, Eden, North Carolina. You can start the clock. I have given each of you a copy of a booklet, and in that booklet you're going to find several things. One of them is a study that was done by Cone Health and the Reynolds Health Foundation. If you want a more detailed analysis of that, you can obviously find it online. It's about a 187-page report, which is why I didn't print everything out for you. In addition, in that pamphlet, you're going to find a graph that talks about labor force and job creation in Rockingham County. And with that in mind, I'm going to get rolling here. Medicaid expansion is designed for people who have an income, who are working, but make too much money for Medicaid, but not enough money to get health coverage on the health exchanges. The second thing that I think is absolutely critical you remember is that from about 2010 through now, every citizen in Rockingham County who pays taxes is paying for Medicaid expansion, but we are not getting it. We are paying for it, we are not getting it. Now, one of the things that I think is critical that we look at is Medicaid expansion is not just about taking care of sick people, while that's important. But Rockingham County, last year, in the last 5 years, we have only created 639 jobs. That's an average of about 120 jobs per year. That's not even enough jobs to take care of 1/2 of the graduation class of one high school. If you look at our labor force numbers, since January of 2010, we have lost 3,220 people out of our labor force. In other words, our labor force is down 7.8%. The Medicaid, if you're following me with this chart, the Medicaid expansion in North Carolina is expected to produce 475 jobs here. These are jobs that we need. These in medical facility, medical field, and they're usually good paying jobs. The second thing that I think we need to look at, well, before I go on, let me ask you a question. How on earth can we expect the taxpayers of Rockingham County to create jobs in states like Arizona, New Jersey, and tell our people here, we're not going to create jobs for you? And you ask why I pick out those two states. Well, actually, there are 4 that I'm picking out. One of them is New Jersey. The presumptive presidential nominee, a Republican, he took Medicare expansion. The presumptive presidential candidate from Ohio, John Kasich, his state has Medicaid expansion. The governor of Pennsylvania has passed, or is working on right now, Medicaid expansion. And perhaps the most Tea Party conservative governor in the United States is Jan Brewer of Arizona, and she also has taken Medicaid expansion. This issue is no longer an issue of politics. This is an issue of rational versus irrational economics, and I'll move on from there. We can't ask the people in Rockingham County to pay for job creation in Arizona. The next issue is our hospitals. They are in dire financial trouble around here, and Morehead has laid off 50-some people and cut the time back on 106 employees. Morehead Hospital is our largest single-sector private employer in Rockingham County. So when they're hurt, the county hurts. Now the question again becomes, how do you ask the citizens of Rockingham County to pay their tax dollars to help the financial stability of hospitals in Arizona when we're unwilling to help the hospitals, Annie Penn and Morehead, right here in our county? This next issue is the number of people covered. Rockingham County will stand to cover 3,000 people under Medicaid expansion. We are a Tier 1 county. We don't have enough jobs for everybody. So we have the opportunity to create 475 jobs. That's not going to solve the problem for 3,000 people. So the question now becomes, how do you tell 3,000 citizens of Rockingham County, we're not going to give you medical assistance because we're going to take your tax dollars and send them to Arizona? It just doesn't add up. The next place you've got an opportunity is when you look at the economic impact numbers down at the bottom. One of those numbers that should strike your fancy is $1.1 million in new taxes that will flow to the cities and the counties. But the more important number here is the $126 million that will be added to Rockingham County's economic status over a 4-year period. Now I want you to think about that in context. In order to produce $126 million worth of economic activity, we would need 900 jobs paying $35,000 each. Our small businesses operating in a Tier 1 county are fighting for survival, and they are struggling to keep their head above water. So the issue here is not just a matter of are we helping sick people in the hospitals. We have an opportunity to help a multitude of your constituents. We have the chance to help our small businesses, our hospitals. We have the chance to create jobs, and we have a chance to help people who need health care. And one of your county commissioners that's not here tonight is a prime example of somebody who has worked all their life, worked hard, and finds themselves in a situation where they would be covered by Medicaid expansion. 3,000 people is a lot of people. We can't ask our citizens to pay for health care in Arizona and deny it here at home. You have a number of options available to you. You can say no. You can duck and hide from this issue by saying you don't want to take a, pass a resolution on a legislative issue, but the truth is that's hiding. And you also have a third option, and probably some others that I haven't thought about. You could stand up for your hospitals. You could stand up for your small businesses. You could stand up for the people of this county. You could stand up for job creation. You could stand up for us. We are desperate in this county. Look at the labor force chart. Look at the job creation chart. Look at the whole economic package of this. Look at the people, the 3,000 people, some of whom will die. That's not hyperbole. I have a friend who died because they did not have access to health care. Which one of you wants to talk to a son or daughter, mother or father, sister or brother, and tell that person their loved one will be the last person to die before we pass Medicaid expansion? How many people have to suffer before we come to the reality Medicaid expansion and the ACA are here to stay? All of you have in your booklet, on the back page of this article, is a partial copy of an article that appeared in the Charlotte Observer. This article talks about leading Republican people, figures in the Republican Party on a national scale, say the war on Obamacare is over. We need your help. We need you to stand up for your constituents. This isn't about me. Just like fracking's not about Ira, this isn't about me. I've got health insurance, I've got a job, I'm going to retire. If you want Rockingham County to grow and prosper and be the place that all of us grew up, something's got to change, and it's got to change quickly. Thank you. God bless you all.
Thank you. Thank you, Mr. Osborne. No,